Impact began in 1982, so we're more than 45 years into the program. Impact stands for Inclusive and Modified Physical Activity for the Community Today.
Impact is a hands-on learning experience for not just the students, but also the participants in general.
It's a series of programs that provides opportunities for people with disabilities in the local community to engage in physical activity. Our primary program for Impact is run on Friday nights, and we have more than 75 youth with disabilities come in. Each of them are paired with an OSU student to engage in physical activity.
45 minutes in the pool, 45 minutes in the gym, different ranges of disabilities, and it's a great experience for not just the students, but the participants as well.
We also have an Impact for Life program that is for young adults with disabilities after they've aged out of our primary Impact program, where they're still working with one of our OSU students to engage in physical activity, but we're going out into the community, into local recreation facilities, into gyms, into yoga studios, so that that physical activity is embedded within the community. I enjoy working with this program because you get to see the positive benefits that it has for our participants. We know from the research, both that's been done here at Oregon State and around the world, that youth with disabilities have fewer opportunities to engage in physical activity. So Impact on its own is providing those opportunities for people in our local community to be physically active, to learn motor skills, to get to experience new ways to be active. And that alone is a major benefit to our local community. The second is, as we take Impact for Life out into the local community, other people get to see that people with disabilities can be active, that they can engage in physical activity if they're given the right opportunity. The opportunity to see them grow up and to continue to develop and learn new skills over time is such an amazing experience. We have students who are engaging with the program through a kinesiology course. We have others who are taking it for experiential learning, and we have others that are just volunteering because they're interested in working in this population.
When I started participating in Impact, it really broadened my horizons on what there is out there in the physical activity world, what physical activity not just means to me, but it can mean for other people.
All of them are gaining great experiential learning, hands-on skills of how to provide physical activity for a variety of populations.
It definitely gave me different insight, and it was where I found my passion in physical activity and what I want to do in the future.
They have the opportunity to take those skills out into their own communities when they leave Oregon State.
Without that opportunity, I wouldn't know where I wanted to be.
When I was a student, I was involved, and I was a group leader, and was actually involved with the youngest group, our tots, our preschool group, and it's now interesting to see that those participants who were little kids when I was a student are now young adults and are out in the community engaging in physical activity, and it's just amazing to see the progress that they've made and how physical activity has become a part of their lives. The future of Impact is to continue to expand the offerings that we are providing, both for our participants who are in the program as well as for our students. We're looking at ways to incorporate new activities. We've added rock climbing as an activity that's done here on campus, but looking at other outdoor activities like skiing or cross-country skiing or snowshoeing or hiking as ways to get outdoors, enjoy the things that we have access to in Oregon, and make those activities as accessible as possible as well. I believe that Impact is the embodiment of the mission of the College of Health, and we know that people with disabilities are more likely to experience health disparities, and it's through programs like Impact where we can provide opportunities to be physically active, where we can train future professionals in the allied health fields to be able to work with people with disabilities.
Because of my experience at Impact, I really solidified where I would like to be moving forward in my career.
We can truly change the mission around public health to make sure that everyone has the ability and the opportunity to benefit from health.